Hello class, my name is Anthony Arvizu, and today I'm going to be talking about the role and responsibilities of community and public health. I want to start off by discussing the topic of my thesis, which this presentation will describe different areas of community and public health services, programs, and their functions. The first part I want to talk about is the role of community and public health in the well-being of populations. The role of public health is simple when it comes to the well-being of populations. For it's important to note that the central mission of public health is to achieve social justice, which has been described both as the foundation and the core value of the field. Community is often referring to a group of people living in a geographical area, and health is usually dealing with race, ethnicity, and religion characteristics. As you can see by the slide, for public health is the science and art of preventing disease, prolonging life, and promoting health and efficiency of the individual and personal hygiene, the organization of medical and nursing services for the early diagnosis and preventative treatment of disease, and for the development of the social machinery to ensure everyone a standard of living adequate for the maintenance of health, so organizing these benefits as to enable every citizen to realize his or her birthright of health and longevity. The role of community health refers to the health status of a defined group of people and conditions to promote, protect, and preserve their health. On the next slide, we talk about the public health organizational structure. In order to describe the public health organizational structure, it's important to know what the public health system is. The public health system, one, was thought of as a comprising only of official government public agencies, but now it is understood to include both other pool sector agencies, such as schools, Medicaid, and environmental protection agencies, and land use agencies, and private sector organizations whose actions have significant consequences for the health of the public. For within this public health system, you have the public health organizational structure, which includes the following: institutional capacity for public health, programs that deliver structures, public health aspects of healthcare services, and capacity to respond to emergencies. According to the Office of Government, ethics is responsible for 6 key elements. Those elements are as follows: overseeing of the financial disclosure system, maintaining enforceable standards of ethical conduct, ensuring that executive branch ethics programs are in compliance with the laws and regulations, conducting outreach to the general public, sharing good practices with and providing technical assistance to state, local, and foreign governments and international organizations. Lastly, by providing education and training to the more than 5,700 ethic officials as well as executive branch employees. For those that don't know, this is the legal and ethical dimensions of public and community health services. Next, we reach analyzing the funding of public and community health services. When analyzing the funding of public and community health services, one thing comes to mind: cost containment across the health system. For several provisions in the ACE alone seek to contain costs related to healthcare expenditures. Reductions in payments to certain health plans and providers in Medicare and Medicaid account for some proposed savings, as do programs to implement administrative streamlining and to reduce waste, fraud, and abuse. In addition, the legislation imposes an excess tax on plans with expenditures above designated dollar amounts to deter the provision of excess benefits, or so-called Cadillac tax. Here is a list of public health services that are most important services available for the people in need of health insurance. The Affordable Care Act, new guidelines for access health insurance. Medicare, federal health insurance programs for people aged 65 and older. Medicaid, administered by state, provides health insurance to low-income people. And WIC, which is a supplemental food and nutrition program specifically designed for women, infants, and children. It's also important to address that, taken together, a range of ACA provisions designed to expand insurance coverage, control costs, and target prevention have the potential to improve population level health outcomes across all income groups. If properly implemented, these provisions could alleviate some of the burdens imposed on the public's health by insufficient availability of health insurance and inadequate access to healthcare. Last but not least, the role of communication in community and public health programs. For the public health programs succeed and survive if organizations and coalitions address these 6 key areas. Innovation to develop the evidence base for action. A technical package of a limited number of high-priority evidence-based interventions that together will have a major impact. Effective performance management, especially through rigorous real-time monitoring, evaluation, and program improvement. Partnerships and coalitions with public and private sector organizations. Communication of accurate and timely information to the healthcare community. Decision makers and the public to affect behavior change and engage civil society. And political commitment to obtain resources and support for effective action. I want to thank you for listening to this PowerPoint. And again, this topic was the role and responsibilities of community and public health. And here are my references. Thank you.